to another session of Vigyan, where we gain knowledge. In this session, we will be discussing very interesting things regarding the lesson, why do we fall ill? Let's get started. In this session, we will be discussing few important aspects. We need to understand the difference between four important terms. So we will start with, although people use these three words alternatively, they are not one and the same. So let's start with the first two terms, symptom and a sign. Now, how do you know that you have a disease? What does a disease look like? For example, you are coughing. So that is an indication that something is not well. Symptom lets us know the presence of a disease. For example, fever. A fever could be due to bacterial infection, or it could also be due to cancer. Symptom lets us know that a disease is present, but it does not tell us which disease. We know that something is not well with our body. We go to a medical practitioner, a doctor. Now, the doctor will ask us a couple of questions as to know the cause of the symptom. And based on the symptoms, looking at the symptoms, they will zero down on a particular disease. So science will tell us what could be the disease. So symptoms are for the patient, whereas science is for the doctor. Based on the symptoms, the patient knows that there could be a disease. They don't know which disease. Now, when you go to the doctor, based on the symptoms, it is an indication, it is a sign to the doctor what the disease. Once they have a clear indication, they will definitely ask for some laboratory tests, maybe a blood test. And once the test is done, they will confirm the disease. So, the disease can be confirmed. That is what is a symptom and a sign. So, cough is not a disease. Fever is not a disease. Fever is a symptom. How is a disease different from a disorder and a syndrome? Now, disease has a specific cause or reason. Let me take an example to explain this. So let us say typhoid. Typhoid is an example for disease because we know what causes typhoid. Positive agent of typhoid is Salmonella typhi. So the exact specific cause or reason is known, disease. Different people suffering from the same disease usually show the same symptoms because the cause is the same. That is about your disease. For example, cardiovascular diseases. These are abnormalities or diseases of the heart, of the circulatory system. And the cause or reason is very clear. It could be a genetic, or it could be due to mutation, or it could be due to a specific infection causing pathogen. Now, how is a disorder different from a disease? Disorder, something is not functioning well. Disorder is because of the presence of a disease. Due to a presence of a disease, the body structure or function does not perform well, function is impaired. For example, let us say cardiovascular disease. We know what the cause is. Now, because of cardiovascular disease, it can cause a disorder called as arrhythmia. What is arrhythmia? Rhythm means in a particular order, continuously. It is repeating in a proper rhythm. Now, arrhythmia is a disorder of the heart where the heartbeat is irregular. The rhythm is absent. So, now because of the presence of a cardiovascular disease, it can lead to a disorder. What is a disorder? The heartbeat is irregular. So, you see, disorder is basically the function is impaired because a disease is present. For example, we say mental disorders. Mental disorders. So, there could be an underlying pathophysiological cause, underlying disease due to which the body shows disorder. Coming to the next word, that is syndrome. A syndrome is a collection of symptoms which may indicate a specific disease related to a specific disease. For example, acquired immunodeficiency syndrome. Now, this AIDS, we know it is caused by a HIV, that is human immunodeficiency virus. So, the causative agent is known, but the symptoms are huge, symptoms are large. There are many symptoms. Why does it happen? Because the HIV virus, it will destroy the immune system. It destroys the immune system of the body. Now, when the immune system is compromised, it makes the body susceptible to various attacks from external agents. For example, a simple cold can turn into influenza. A simple cough can turn into tuberculosis or pneumonia because the immune system is weak. Small symptoms, when they accumulate, when they acquire, can be life threatening. For example, AIDS. Therefore, AIDS is not a disease. Let's now discuss the next topic, that is the causes of diseases. So, what is the reason behind the disease? Is a child in a village. This child falls sick and he or she is suffering from loose motions. Now, why did the child get loose motion? If you answer this question, it could be because of a infection. There could be some bacterial or some pathogenic infection. Loose motion is a symptom. Okay. Now, there were many children in that village who drank water from the same water source. Why did this particular child fall ill? Why not the others? The reason could be because the child was not healthy. Other children were healthy. Why was this particular child not healthy? Because of poor nourishment. Because of lack of a proper balanced diet, the child is not in proper health, therefore it fell sick. Now, if you answer question like why was the child not given proper food, that could be because the family could be poor. Why was the water source not managed properly by the administration? So poor public health or poor services, the administration has not done its duty well enough. So the causes could be of various levels. The infectious agent could be the primary cause. This can be secondary and tertiary. So if we are talking about causes of diseases, so behind every disease there is a primary cause and there are contributory causes, and primary cause is a immediate cause. What is the reason for the disease? What is the immediate reason for the disease? So causes can be classified as immediate causes and contributory causes. The immediate cause in this case was a infection caused by a pathogen. So immediate causes include pathogens. Contributory causes are many. If all these are fine, there could be a genetic cause. Genetic cause, that is, this particular child has a genetic makeup which is susceptible to diseases. When the pathogen is absent, the child does not develop any disease. But when the pathogen attacks the body, because of a predisposition, the child can fall sick much faster than other children due to the genetic makeup present in the child. So this could all be contributory causes which are not directly causing the disease, which will assist in aggravating the disease. Now that we have discussed the causes for diseases, let us look at the types of disease or classification of diseases. Diseases can be classified based on two factors. One is the time duration, whether the disease lasts for a short period of time or does it persist throughout the lifetime. For example, a disease like cold, it lasts only for 3 to 4 days or maximum a week. So cold is an example for a disease which is of short duration. So such diseases which are existing for short duration are called as acute diseases. For example, cold. Now, then there are diseases that are present for long duration, for months and years together. So such diseases which exist for long period of time are called as chronic. Acute means small, short duration. Chronic for a long duration. Example for this, we can take it as diabetes, high blood pressure, or asthma, tuberculosis, elephantiasis, etc. So I will take the example of asthma. So because of asthma, the person throughout his or her lifetime should be dependent on medication, point number 1. Because of this condition, they will have breathing problem throughout their lifetime. Because of this, they face weakness or fatigue. They are always tired, and because of that, it will affect their day-to-day work. So acute diseases do not affect the immune system that much, whereas chronic diseases, they have drastic effect on the immune system. It can have drastic effects on the health throughout the lifetime. There is not much effect on the health in a severe manner. So that is the difference between acute diseases and chronic diseases. These are classified based on the time duration. Now, we know that the immediate cause of a disease, what causes the disease? We know it is a pathogen. Pathogen is defined as a disease-causing organism. For example, the disease typhoid is caused by Salmonella typhi. So, Salmonella typhi is a bacteria which is the pathogen. Malaria is caused by Plasmodium malariae, which is the pathogen. All diseases are not caused by pathogens. There are some diseases which do not require pathogens. So, based on the cause of the disease, or we can say whether the disease spread or not, based on that, the spread of the disease, we can classify the diseases into infectious diseases, infectious and non-infectious. In the case of infectious diseases, they are caused by a pathogen. There is a infection causing agent. In the case of non-infectious diseases, these are non-pathogenic, which means a microorganism is not involved. When we understand the examples, we will be able to appreciate it. For example, infectious diseases, let us say sexually transmitted diseases, typhoid. Examples of infectious diseases that can spread from an infected person to a healthy person because there is a pathogen involved. This pathogen can be transferred. In the case of non-pathogenic diseases, these are mostly lifestyle diseases. We call them as lifestyle diseases. For example, obesity or high blood pressure, high BP. Are they caused by any microorganism, any bacteria or fungi or any pathogen? No. These are because of the internal factors of the body, whereas pathogens are external. So, non-infectious diseases are non-pathogenic. These are mostly, they cover the lifestyle diseases. Or not, we can also call them as communicable diseases and non-communicable diseases. Cancer is not caused by any pathogen. Cancer is caused due to the uncontrolled division of the cells. The cells will lose control over their cell cycle and they will keep on dividing, resulting in a mass of cells called as tumor, which is cancer. But it is not caused by any particular pathogen directly. Another category of diseases are what we call as genetic diseases. These are the diseases that we inherit from our parents, which are transferred from the parent to the child. One interesting example is a disease called as hemophilia. Patients suffering from hemophilia, they cannot undergo the blood clotting process properly. So whenever we get a cut or a wound, we know that blood will, after a few minutes, the blood flow will stop. This is because a clot is formed which will stop the leakage of blood. But in people suffering from hemophilia, because of the absence of a particular factor, it could be factor 8 or factor 9, which is crucial for the blood clotting process, they don't have this. So the blood will keep on flowing unless you inject this factor from outside. Now, this is a genetic disease because it is transferred from mother to a son. And another interesting phenomenon is only males have this disease. The mother carries the gene for the disease, but she herself does not have the disease, the genetics of which you will study in your higher classes in class 11. At the end of this interesting session, you should be able to understand these important points. You should be able to define a disease and differentiate it from sign, symptom, disorder and a syndrome. You should also be able to identify the causes of disease, the immediate cause and the contributory causes. Then you should be able to classify the diseases based on the duration of time, based on whether they are spread or not, and you should be able to identify the genetic diseases. Thank you.